Hi friends, I'm Dr. Heather Duncan with River Oaks Animal Hospital, and in this video we're going to talk about kidneys and their role in dogs and cat health. So what do the kidneys do? Well, most of us think they make pee, and you'd be right, but they do a lot of other function as well. There are many things that we don't even think about that makes the kidneys so important to our daily health. First off, the big one, they conserve water. Not only do they help by pulling in the water and making sure your body stays hydrated, especially in times of dehydration, but if you drink too much water, guess what? They help get rid of it. So it's super important in keeping that water balanced. And it's probably the reason why everybody knows that that's what they do, because it is one of the most important things that the kidneys do. But second of all, they help with toxins. They get rid of biological waste, metabolic waste that our body is producing on a daily basis. Some of these waste, which you may hear when your doctor or your nurse is going over blood work, are things like BUN, which stands for blood urea nitrogen, or creatinine. Both of these are products, they're byproducts of metabolic processes, and when they build up in the bloodstream, they actually can make you very sick. It's called azotemia. But some other things, those are the two big ones that most people know about, but other things that the kidneys do are calcium and phosphorus balance. It helps to get rid of phosphorus in your system. If one or the other is lacking or too much, it can actually lead to a lot of problems, including crystal deposition in muscles and in the bone, and it can make your bones rubbery. So super important aspect of kidney balance there. Another thing that the kidneys do is sodium-potassium balance. It helps control these electrolytes. And keep in mind that if the kidneys lose their ability to help conserve potassium and potassium levels begin to drop, then you start to feel really weak and really tired. And it can actually lead to some heart problems too, leading to blood pressure regulation. Did you know your kidneys were super important with blood pressure regulation? Kidneys actually have sensors in them that help regulate the blood pressure in the whole body. It's one of the organs that does that. And so when these are damaged, it can actually lead to hypertension or high blood pressure. And that can lead to more damage of the kidneys. Protein conservation is another big one. Your body uses a lot of proteins, and they're constantly circulating in the bloodstream. And if your kidneys lose the ability for the kidneys are made up of all these little filtration units called nephrons. There's millions of them in there. And if the nephrons aren't working appropriately, then your body can't conserve those proteins. Kidneys, super important for red blood cell production. So your red blood cells in your body, most people don't think about this, but they're constantly being produced and they're constantly being lost. And so we have multiple factors and multiple processes in our body that helps to regenerate these red blood cells. And one is the kidneys. The kidneys produce a hormone called erythropoietin. And if you lose enough of these nephrons or functional units of the kidneys, they can't produce this hormone. And then you stop producing red blood cells. And so that leads to some serious problems, especially in dogs and cats, because we don't have a great substitute for this hormone to supplement them. We can use the human form, but it doesn't always lead to good results. So sometimes in severe kidney failure cases, the only treatment option we have are blood transfusions. And then finally, kidneys are super important for pH balance. Metabolic processes within your body, they function in a very narrow pH range. And if that is thrown off by any means, then you got some problems. And so the kidneys help manage that. So why am I even talking about this? Well, it's because kidney disease is a super common finding in our pet population. It's one of the most common things that I see. When we're doing blood work, annual blood work, we hopefully are catching this early. And that's the reason why at our clinic, we definitely recommend annual blood work. And it's so we can catch the very early changes. If not, then we're not going to see the changes until the pet is starting to show clinical signs. So what are those clinical signs? Well, you got to look at what the kidneys do. So first thing that you typically will see is increased thirst, increased urination, and it's because the kidneys aren't conserving the water the way they would typically. Then you might see things like they're not eating very well. Maybe they're vomiting. Maybe they're losing weight. Maybe they're lethargic. And in severe cases, maybe they act drunk. They're wobbling around, they're falling down, they're not stable. All of those are potentially signs of kidney disease. And like I said, if we catch it early enough, hopefully we don't get to that point for a long time. So what causes kidney disease? Multiple factors play a role in it. A big one that we see is just aging changes, geriatric changes to the kidneys. As these nephrons start to just die off due to normal wear and tear. Other problems can be bacterial infections. The fancy word for that is pyelonephritis. We also have things like cancers and congenital defects where you're born with abnormal kidneys, and then toxin exposure. There are things that are out there, different medications like ibuprofen, different toxins that could be in your garage like antifreeze, and even plants in your house. So what do we do about it? Well, the unfortunate truth is that there is no cure in most cases for kidney disease. If we can catch things like infection or toxins, in some cases even cancer, early enough, those do have treatment options. Our changes due to aging and congenital defects, those are a little bit more difficult. There are kidney transplants that are available. They typically are done through academic institutions like the vet schools, but they are very costly. There are very narrow parameters that qualify a patient to get a kidney transplant. And guess what, guys? You leave with 2 pets because you typically have to also adopt the donor animal. So realistically, that's not an option for many people. So what we do is manage it. It's a disease that we manage. And we do that by addressing the different things that the kidneys do. And so first up is water consumption. We want to make sure that we always have fresh water. Sometimes that includes getting a fountain, a water fountain, especially cats. They love that movement, and so they drink more. We generally will switch their diet. There are many prescription kidney diets on the market, and they hit some of the aspects of kidney function just in a diet change. So potassium regulation, phosphorus regulation, protein management. And if we switch to a canned food, it also helps with water consumption and dehydration issues. Sometimes, speaking of dehydration, if we can't manage that and control it with diet and water intake alone, then we're going to teach you how to do fluids underneath the skin at home. And it is surprisingly easy, guys. So don't be worried about that. That's something that we can teach most people. Kidney disease also leads to hypertension and blood pressure issues. So that's something we're going to want to check regularly so that we can catch it early and treat it earlier. And then, just in general, just making sure that they feel good. And sometimes that involves adding in an antacid to help reduce vomiting and encourage them to eat. Sometimes we have to add in appetite stimulants if they're not eating well enough. But the big key with this is that we are born again with 2 kidneys and millions of nephrons. And as we live our lives, as our pets live our lives, these nephrons are either going to die off due to disease or simply just because of wear and tear and normal aging changes. When we're down to less than 1/3 of our kidneys functioning nephrons, then we're going to start seeing changes on our blood work. And that's why we really recommend annual blood work, and that's just to catch this as soon as we can and start some early changes to help your pet live longer. If you have any questions at all about kidney disease, what the kidneys do, how we can further protect the kidneys, then please leave a message below, check out our website, check out our Facebook page, or give us a call. Thank you so much for your time. Have a blessed day.